Hello and welcome back to the podcast series where we unravel the complex world of healthcare one breakthrough at a time. I'm your host, and today's episode is something that touches patients, families, and policymakers across borders. Decoding medical tourism, separating hype from high-quality care. Whether you're someone exploring treatment abroad or just curious about the growing global trend, this episode will dive deep into what's real, what's risky, and where the future is headed, especially when it comes to the United States as a destination for advanced medical care. Let's start with the basics. Medical tourism refers to people traveling across international borders to obtain health care, from elective procedures to life-saving treatments. And it's booming. Why? Because many patients face one of three things in their home countries: long wait times, lack of specialized care, or outdated medical infrastructure. In 2023 alone, more than 21 million people globally engaged in medical travel. India, Thailand, Mexico, and Turkey have all emerged as major destinations for cost-effective surgeries and dental work. But when we talk about complex diseases like cancer, rare genetic disorders, or organ transplants, there's one name that stands out: the United States. Now let's break down the American medical tourism offering. The US isn't known for being affordable, that's true. But what makes it one of the most sought-after destinations for critical care is this: innovation. We're talking about access to world-renowned hospitals like Mayo Clinic, Cleveland Clinic, and Johns Hopkins. Cutting-edge clinical trials in cancer, Alzheimer's, and rare diseases. The latest robotic surgeries, CAR T cell therapies, gene editing technologies, and perhaps most important, extremely low waiting times for high-priority cases. So is it hype? Not quite. The US continues to lead in precision medicine, FDA-approved advanced drugs, and multidisciplinary expertise. And patients who have exhausted all options elsewhere often find hope here. But that doesn't mean the process is perfect. And here's where we separate reality from myth. Let's be honest, crossing borders for medical care is not as easy as booking a flight and seeing a doctor. Let's be honest, crossing borders for medical care is not as easy as booking a flight and seeing International patients often face visa challenges, language barriers, unfamiliar healthcare regulations, emotional and logistical overwhelm, and sometimes misleading promises from unregulated medical tourism agents. That's where the quality versus hype conversation becomes crucial. Patients need verified information, ethical partnerships, and clear treatment pathways, especially when it comes to serious diagnoses like cancer, rare diseases, and genetic diseases. Let me share a quick real-world example. Another story. Arjun, a 9-year-old boy from Bangalore, was diagnosed with Batten disease, a rare, fatal genetic disorder, after years of misdiagnosis. In India, treatment options were non-existent, and his condition was rapidly deteriorating. Desperate for answers, his family turned to MediPocket USA, where he was quickly matched with a US hospital running a cutting-edge gene therapy clinical trial. Thanks to fast-tracked access and full support from MediPocket's medical concierge team, Arjun was enrolled in the trial within weeks. The results? His condition has stabilized, and he's regained mobility and independence once thought lost. These stories highlight something simple. When done right, medical tourism can save lives and build families. But you need the right gateway, and that's where MediPocket USA makes the difference. We're not just facilitators, we're a trusted cross-border healthcare concierge, helping international patients get direct access to top US hospitals, doctors, clinical trials, and premium medical concierge services. From medical visa support and specialist matching to legal guidance and travel accommodation, MediPocket USA takes the confusion out of the journey, so all that's left is care delivered with compassion, clarity, and world-class precision. Thanks for tuning in to this episode. If today's conversation helps you see medical tourism in a new light, share it with someone exploring their healthcare options. And remember, whether you're navigating cancer, fertility, or rare diseases, distance should never be a barrier.